Welcome back. Shuttle DPT, another anatomy breakdown, muscle by muscle. Today we're finally tackling the pectoralis major. Big boy, big bodybuilder beach muscle, bench press's best friend, one of the most visible and most trained muscles in the upper body. But it's also way more complex than most people even realize. So whether you're a student, clinician, trainer, or athlete, understanding this muscle goes way beyond just pec flies and chest day. So let's break it down. The pectoralis major is a thick fan-shaped muscle, makes up the bulk of the chest. It's got two heads, so we've got the clavicular head up top and the sternocostal or sternal head below. Both of them converge to insert on the upper humerus. That broad origin and narrow insertion give it a strong mechanical advantage and a ton of upper body movements. So think pushing, lifting, hugging, and punching. It's a really big mover, so if it involves your upper extremity, it probably involves the pecs. Pec major has a really wide origin, starting from the anterior surface of that medial half of the clavicle for the clavicular head, then from the anterior surface of the sternum, the upper 6 costal cartilages, and the aponeurosis or flattened tendon of the external obliques for that sternal head. From there, the fibers come together, traveling laterally and inserting onto that lateral lip of the bicipital groove. We spoke about our lady between two majors mnemonic in the lat dorsi and teres major videos. Pec major tops off that trio with its narrow strip insertion. That broad to narrow fiber arrangement of pec major allows for powerful movement across multiple planes and explains why the angle of your arm, like incline versus decline bench press, changes which part of the pec you're biasing. So just to reiterate, pec major originates on the anterior surface of the medial half of the clavicle, the anterior surface of the sternum, and the upper 6 costal cartilages, as well as the aponeurosis of the external oblique. Pec major is innervated by both the medial and lateral pectoral nerves. That's somewhat interesting because the medial pectoral nerve comes from that lower portion of the brachial plexus, C8 and T1, while the lateral pectoral nerve comes from the upper portion, C5 through C7. These nerves pierce through and innervate the muscle from both sides, allowing full activation of the broad fan of fibers. That's pretty interesting. That tidbit's definitely worth knowing, especially in surgical or spinal cord injury patients. Partial nerve damage can lead to segmental weakness or atrophy that might not show up unless you're looking closely, so definitely one of those things you want to keep in mind. To clarify on our innervation, pec major is innervated by both the medial and lateral pectoral nerves. That's nerves C5, C6, C7, C8, and T1. So as we mentioned, pec major is a powerful, multifunctional muscle that drives a wide range of upper body movements. Its broad origin and converging fiber pattern give it leverage to move the humerus across multiple planes. Our primary functions for pec major will be shoulder adduction, shoulder internal rotation, as well as horizontal adduction of the shoulder. So think hugging, pressing, or throwing motions. The clavicular head plays its biggest role in shoulder flexion, especially from a neutral position. And the sternal head can contribute to shoulder extension from a flexed shoulder position. So with the potential to be involved in such a wide range of movements, it's easy to imagine how different angles on the bench press would target different regions of the pec. Functionally, this muscle is engaged in essentially every pushing or pressing movement. But from a push-up to a power punch to a heavy chest day, you'll definitely be involving those pec major fibers. So to summarize all of that, the functions of pec major include adduction of the humerus, internal rotation of the humerus, horizontal adduction of the humerus, shoulder flexion, and a little bit of shoulder extension from a flexed shoulder position. This is your major pushing muscle. If you're doing bench press, dips, push-ups, punching, hugging, your pec major is doing its job. Pec major is definitely one of our vanity muscles. A gym goer's favorite, but not nearly as big a deal in the clinic. We do have our occasional ruptures though. Pec major injuries are most commonly seen in high load activities like bench press or contact sports, especially with that sudden, forceful eccentric loading. That's something to think about for guys that speak specifically to a bench press injury. If they report a pop around that shoulder, they've got the swelling, bruising, they've got a change of shape around that armpit area, very likely that they've torn that pec major tendon. It's also not abnormal to see pec major shortening and postural dysfunction. We mentioned that upper cross syndrome presentation in some of the earlier videos. Pec major is definitely one of those muscles that gets tight and shortened and contributes to that protracted shoulder and internal rotation pattern that we see. For my gym brothers, when it comes to activating the pectoralis major, EMG studies have consistently shown that those horizontal pressing motions, pressing exercises, like barbell bench press and push-ups, produce the highest levels of muscle activation, especially with that wider grip. According to an EMG meta-analysis from 2023, the barbell bench press, especially with a flat or slightly inclined setup, elicits the highest activation in both the clavicular and sternal heads of pec major, making it one of the most effective strength exercises for overall pec recruitment. Additional studies would support the use of dumbbell variations like the flat dumbbell bench press and dumbbell fly. These also produce a ton of activation, but give you a bit more of a natural movement path and less joint constraint. So clinically, this research supports the use of both barbell and bodyweight pressing movements, as well as the dumbbell variations, and that's in both the rehab and performance settings. Some other tidbits we would mention would be to use a 30-degree incline to train those upper fibers, that clavicular head. You do want to avoid anything steeper than that, because that will shift emphasis to the deltoid. You could also include your decline presses for the lower fibers. So bottom line, this isn't just a gym muscle, it's also a foundational rehab muscle. It's a huge player in shoulder health, surgical rehab, and athletic performance. So definitely important to know a lot about the pec major, regardless of what your goals are. So that's that pec major, an iconic muscle with much more to it than just its size and strength. Whether you're managing injury, optimizing movement, or just looking for purely aesthetic gains, understanding your pec major is critical. If you found the breakdown helpful, hit the like button, drop a comment, and subscribe for more. Much more to come. Thanks for watching. Pedal DPT. I'll catch you next time.